I got my A1C labs back. I got an updated A1C lab done. And if you didn't know this, I actually was diagnosed with PCOS many years ago. And, PCOS comes with a lot of different symptoms. But one of the main things that I've had to manage is my blood sugar. And since I've had PCOS, I've just learned so much about how different PCOS can look than like a traditional like diabetes, in terms of like the insulin resistance and how the insulin and glucose behaves. And there's like a really large statistic of people with PCOS. I forget the number of however many people with, it's like a big number, people with PCOS will have type 2 diabetes by the time they're 40 years old. And so that's just one of the things I've really wanted to avoid. Both my grandmother and my great-grandmother both my grandmother has, and my great-grandmother had type 2 diabetes. And it's just like a disease I really don't want. Especially at 40, I'm less than 5 years away from being 40. So I just don't want that for my future. And my recent labs came back and showed that my A1C went up despite making so many efforts in recent years to manage my blood sugar. And that was so discouraging. I cried, and it was very sad. And it's just discouraging when you put a lot of effort in towards something and then you're like, okay, here I go. I guess I'm going to keep trying even though it's not working. But the truth is there are some things I haven't tried. And one of those things is wearing a continuous glucose monitor, which I've been wearing several days now. And it has been such an eye-opener for me. I can't even express to you, like, if you're struggling with your blood sugar and you're not yet diabetic and you are really trying hard to prevent it, I highly recommend getting a continuous glucose monitor. I think your doctor can prescribe one, but also you can just buy one. I bought one from Walmart. It's a brand called Lingo, and I think they also sell them at Walgreens. But oh my gosh, it has opened my eyes to just subtle changes that I can be making throughout my day to maximize on the meals that I'm eating, like going on walks right after I eat instead of like before I eat. Unfortunately, there's a lot of bad health advice out there, but for a long time when I was like young, they always said like, oh, fasted workouts are so good. And so I would like go on a walk, or I would like try to get a workout in before eating. And that is just the worst thing I could have been doing for my blood sugar, for myself, because I see my patterns and I have this spike in the morning. And I've noticed that, that doing something crazy enough, like having my cup of coffee, because I use heavy whipping cream in my coffee, I don't use sugar. But having my coffee in the morning actually stabilizes my blood sugar. And so I'm like, okay, that's one habit I'm already doing that's helping me. But anyways, all that to say that like, I am just being blown away about all these different changes I could be making. They're not like crazy either. It's like going on a 10-minute walk after my meals. I can totally do that, especially when it's like the alternative is diabetes. So we're going to try for 3 months. I'm going to whatever I learn using the CGM, I might even get another one because they're for a 2-week period. I might get another one. I might even ask my doctor if she'd prescribe me one for a time so that I can really learn about my body, and that way I can set myself up better. I've already seen such a difference between the first few days I was wearing it to now, my spikes. I've been able to manage my spikes so much better. And so that's been really encouraging, after very discouraging news that I was considered pre-diabetic again. yeah, I just want to try everything that I can naturally before like just taking a medication. Not that there's anything wrong with it. Some people need medication. I just feel like I still have some time to figure this out. And so thanks for being here. If you also have PCOS, if you also struggle with your insulin resistance, I'd love to hear about it. Please tell me in the comments below. I'm really just like learning. Like it's been a lot of years since I've been diagnosed with PCOS, but there's not a lot of like clear directive like anywhere for PCOS. Even each doctor you go to is going to tell you something different, which has been my experience. Some of them just want to hand you like 5 pills, and then some of them are like just reduce your carbs, and it's like, literally, fool, I'm literally eating like 30 carbs a day. So what do you want me to freaking not eat? So it's just been frustrating, to say the least. I do know building muscle is important. My husband's actually been telling me that this whole time. He's a kinesiology major, okay? That's what his degree is in. So he's been trying to tell me building muscle is really important for like all the metabolic things. And I was like, hey, I'm going on a walk, okay? But no, I've been back in the gym because I do now see how important it could be for me. So we'll see. And I'd love to be able to give a really positive update about this 3 months from now. All right, let's go. Put my toner in. Since this disappointment of my blood sugar still being on the rise, despite all of my efforts, I have been feeling at the same time so much care from the Lord, because even though it's not what I wanted, I see how the Lord's provided this space for me to focus on my health in this season. Because if you watch any of my previous videos, you would know that I wanted to homeschool my kids. In fact, they were homeschooled for a bit over a year, and we recently put them back in public school. And I'd love to share the story about how we came to that decision at some point. Also, just grieving the fact that I wasn't going to be homeschooling my kids anymore. It was just such a disappointment for me to move on from that, because I had just put so much effort and I had so much expectation of what our time homeschooling would be like. And even though it ended a bit abruptly, I see how this time has become a very necessary time for me to focus on my health. Because what good is homeschooling my kids if in a few years I have diabetes and I have to manage a new disease? And I see how the Lord's providing space for me to really put a very concerted effort into focusing on my health. And so that has just been something I'm being reminded of multiple times this week, as I have just struggled with the discouragement of, just not my blood work having the result that I hoped. And I can't imagine what it would feel like if I were busy homeschooling on top of all my other responsibilities, and then also still have to figure out a way to go to the gym every day and walk 10 minutes after every meal. It would have just been really overwhelming for me. And so I feel really cared for by the Lord, because I just have the space to focus on my health, and I'm really thankful for that. I want to be able to show up for my family, and I want to show up for my kids for as long as humanly possible. And if this is what this season is going to look like for me, while I get myself in a better position health-wise to be able to do that, then that's what I'm going to do.